Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. First of all, I would like to wish all of our health unit nurses and nurses across Windsor-Essex County a very happy Nurses Week. Nurses across our region have been actively involved in the pandemic since the beginning, and this week recognizes their commitment to our community, so thank you. Today we are reporting an increase of 38 new cases of COVID-19 in Windsor and Essex County. 15 are close contacts of confirmed cases, 9 are community acquired, 1 is outbreak related, and 13 are still being investigated. We have had 15,837 cases since the beginning of the pandemic. 367 people are active at this time, with 173 of our active cases having a variant of concern. To date, 1,158 preliminary or confirmed variants of concern have been identified in Windsor-Essex County, with 92% of these cases having the UK variant, 3 cases have the South African variant, and 4 the Brazilian variant. 22 people from Windsor-Essex County are currently in the hospital, and 3 people are in ICU. Today we are reporting an additional death due to COVID-19. A man in his 80s from the community has passed away. Our community has now lost 417 people to COVID. There are currently 9 active outbreaks in Windsor and Essex County, 8 workplaces, and 1 community outbreak. Now for the vaccine update, 190,878 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 176,666 people have received at least 1 dose. Overall, 52.4% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose. Today we are announcing that adults 40 years of age and older can book an appointment at one of our mass vaccination sites. Residents 18 years and older living in a hotspot postal code area are able to book at 3 of our vaccination sites: Windsor Hall, the Moy Clinic, and Nature Fresh Recreational Center in Leamington. These postal codes include N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. Please visit wevax.ca or call 226-773-2200 to book your appointment. We would also like to provide an update on our targeted vaccination clinics for our local temporary foreign workers at the Nature Fresh Recreation Center in Leamington. Since April 18th, we have vaccinated 4,768 workers with first doses across 132 farms. We would like to thank all of our community partners on the Agri-Food Workforce Task Force who helped with the translation and distribution of vaccine information for our farm workers, as well as assisting with on-site translation during our clinic days. In addition, we would also like to recognize the tremendous support and work put forth by the farm owners and operators. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us this morning. We are all dealing with the impacts of the COVID-19 pandemic, regardless of what we do, where we live. The pandemic is not only affecting us physically, but the stress of pandemic is also having a significant toll on the mental health of everyone. Just like any other health impact, some individuals are more impacted than the others. One particular group that we are concerned about is individuals with substance use disorders. Recently, we issued a number of alerts for our overdoses in our community, and today I want to dig deeper into opioid overdoses statistics in our region, which is significant for what we are looking at comparing in many years. So I'll present some data today. So this graph looks at the Windsor-Essex opioid overdoses cases by year, starting all the way from 2007 and going up all the way up until 2020. And as we can see, the trend is increasing every year, starting all the way from 2016 and then increasing every year with a significant increase in 2020. what we have seen so far is up to 350 cases, which is the highest that we have seen in the region based on where we were. And back in 2016, it was just 100 cases that we reported. So over the last 4 or 5 years, that number has increased significantly. And please note that the number that I'm presenting for 2020 is still preliminary, and it can be subject to change, which means that there may be more data that can be added into this group. So comparing our local opioid data, which is in blue, with the provincial overdose data, which is in green, and we can see that our rates are similar to what the province is seeing, and an overall increase is seen across the province, including our region, which is a concern. And regardless of the pandemic, the trend was already going upwards, and maybe the pandemic is complicating things further, leading to more overdoses, especially in our region. Looking at our data of opioid-related deaths in Windsor-Essex, and a similar picture, the number continues to increase, and our data, our 2020 data is the highest that we have reported so far with 64 deaths. We've seen some stability in between 2018 and 2019 data, but 2020 data definitely has exceeded any other years, which is a concern for our community. When we are comparing our local data with the provincial data, which is again Windsor-Essex data in the blue and the provincial data in the green, and our opioid death was slightly high, but now it's coming closer to the provincial death rates. Looking at our opioid-related deaths in 2020 by the public health units, and we can see that Windsor-Essex is very close to in the middle of the pack, where majority of these cases, as we can see, majority of these deaths are reported in the Northern Ontario region mainly, and it's a concern everywhere, regardless of where we are. Looking at our 2019 and 2020 data, so only 2 health units, if you can see, which is Wellington, Dufferin, Guelph, and Brant County, actually reduced the rate of opioid-related deaths in 2020, whereas every other health unit has seen an increase in opioid-related deaths in 2020 compared to 2020. Some have seen more death than the 2019, and the majority of these are generally the health units in the northern region. Looking at the opioid-related deaths by manner of death, which, and we can see, no surprise, almost more than 97% of our deaths are attributed to accidental overdose, while very few reported in the under the suicide section, and there are some others that are still undetermined. So generally speaking, the message is most of these overdoses are happening with accidental overdose by either having a contaminated batch of drugs or any difference in the potency of the drug that people are using. Among those who are dying is we can see it's generally more in the younger population, and as young as individuals between the ages of 15 to 24 years of age, which is a significant concern, not only in our region, but also in the province, because that's the group that we definitely want to protect. And then moving further, the majority of the deaths are happening between the 25 to 44 years of age, which is again the most productive age group for any society, and going on further, and that trend continues. So it is a concern from the people, from the perspective that it is affecting people in their most productive years of life, and we as a society need to pay close attention to provide the support that they need to be more productive in the society. The type of overdose, the type of opioid that is found in when people died, it generally is fentanyl, and with some indication of other drugs, but by far and large, it's the fentanyl that we know, which is very potent drug, and the potency of these fentanyl coming from different sources has been found to be the contributor of overdoses, accidental overdose, and leading people to die. Drilling it down further where these deaths are happening, and what we can see is a significant trend is the private dwelling. So people are dying in their private residences, and it's not the typical people that we expect, that people living in the street. It is affecting everyone regardless of their socioeconomic status, and it's affecting in all our region, with the number increasing in private dwelling, leading to more concerns in the region, that it is not just an issue that's limited to one particular group or one particular individual. Another concerning trend is individuals who died. There was no one present at the time of death, which is again highlighting the need and messaging around using drugs, which we always say in our alerts, that people, if they're choosing to use drug, please do not use it alone, and have someone present that can help you if you accidentally overdose yourself with the substance that you're using. Another concerning trend is the inability to use naloxone, and partly maybe it's because some of these individuals are using the drugs alone and may not even have the ability to use it on their own, but also signaling the impact that the naloxone use has to be increased across the region. People, especially people who are using drugs, or anyone who know someone using drugs, and to make it available for people if they see any signs of overdose. With respect to number of overdoses that we have issued, 2019 we issued lots of alerts. 2020 we only issued 3 alerts, but as of May 2021 we've already issued 7 alerts, and the year is still we are not even at midway point at this time. So concerning for us in our community, that we may see more alerts coming out this year, and as a result we are all working with our partners to address these issues. Breaking it down further in terms of the drug alerts issued by VCOS, Windsor-Essex Community Opioids and Substance Strategy, by month, and we can see this year in particular we have issued alerts in January, February, March, and April, which we haven't issued in the previous months. And we have issued most of these alerts either in the summer, springtime, and then sometimes in the late fall. But the trend which we are progressing is issuing alerts pretty much every month, which is a concern. That means the use and the access to drug is increasing, leading to many of these overdoses. This graph looks at the EMS alerts that was generated when the primary problem was suspected overdoses, opioid overdoses by month, and this breaks it down further by different years, 2019 all the way up to 2021, and as we can see that the 2021 number was high, but the 2021 data is catching up with the number of alerts that has already been issued. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Dr. Ahmed, do you feel there's a relation between the lockdowns and these opioid overdoses?
Well, as I indicated in the beginning, that any kind of significant impact from pandemic, which each one of us are experiencing in so many different ways, it has an impact on the mental health of everyone, and especially people who are using substance. They are more vulnerable to these type of impacts. We talked about it many times in our presentation. We talked about some of the mental health impacts and toll that it's having on people, not only from a stress perspective, but also from people from the perspective of having access to these drugs, having access to these services. So a lot has happened in last year, and there is definitely the connection as everyone is impacted by the pandemic. This particular group is getting most of the impact, and a troubling trend, and wanted to make sure that the community is aware. There's lots of work that's been happening under the VCOS, Windsor-Essex Community Opioids and Substance Strategy, and many partners are stepping up to take care of this vulnerable group, developing some pathways, developing some of these connections to offer services. So yes, there is that connection, and we hope that we can address some of these issues through our partnerships and the available resources, and look for additional resources as needed.
Have you heard any information from the province regarding the current stay-at-home order, whether it will be lifted on May 20th or if it will be extended further?
At this time, there is no official word, so there's been lots of consideration. Most importantly, how to open it up, what criteria, what indicators to look at. So some of these conversations are happening, but at this time, I don't have anything official.
Thank you.
Any questions from AM 800?
Good morning, Teresa. Going back to the farm worker rollout, just overall, I know a lot of effort by the team has been put into this, like you mentioned, and you credited also the farms themselves. Are you pleased with how the rollout went overall?
Yes, we think it went very well, and we will continue to work with the farm operators and the farm workers to offer continued support for vaccination. As we know, new arrivals to Canada are also getting vaccinated with their first dose, and we will be providing support for second doses when they become available. So overall, I think it did go very well. We were predicting about 5,000 workers, hoping for 5,000, and you can see we did just over 4,700. So that is really, really good.
Do you know if some of these workers that are coming into Ontario, into Windsor-Essex, have some of them, I guess, been vaccinated in their home country, I guess?
Some will have been vaccinated in their home country. We don't have all of the statistics. We do know that they are being offered with the big commercial, the commercial airlines. They're being offered the vaccination upon arrival. And we do have people coming to Windsor-Essex County regularly, temporary foreign workers, and we'll continue to work with them to offer the vaccine and make sure they're protected as much as we can.
Dr. Ahmed, switching to the alerts, like you mentioned in your presentation, 9 alerts in 2019, 3 alerts in 2020, and 7 so far as of this month. Are you worried, concerned that we will see double digits this year?
Yes, Rob, I do worry that while we are dealing with many of the impacts of the pandemic, we should not ignore the impacts on this particular group. We have done a lot of work through our Windsor-Essex Community Opioid Substance Strategy in the last few years, and the pandemic is really taking a toll on everyone. And this particular group is also seeing some of the negative impact. So yeah, it is something that has been troubling us, all of us, and we are trying to work with our partners to find more better ways to engage this population, better ways to create awareness. Some of the data that we presented, touching on these overdoses happening in the private dwelling, and not having anyone who's not having anyone close at the time of the overdose, or inability to use naloxone. So those are some of the key life-saving decision points that needs to happen. How we can increase that, looking at some of these pathways, looking at making some of these connections. So a lot of the work that we need to do, but we also wanted to make sure that the community is aware of the reality of what is happening, and also educating some of our community members about who's impacted, how they're impacted, and what role they can play to prevent some of these overdoses and also deaths.
Just one final question here on alerts. From 2019, 9 alerts, and then 3 alerts in 2020. Did the health unit point to, I guess, I'm not sure what word to use here. Why was there such a difference, I guess? Was that looked into, I guess, between those 2 years?
So some of the I guess I would say the data, when we are getting those data and how we are issuing those alerts, we were still I guess tweaking to make sure that we get it to the right point. And also we are all dependent on whether this is reported to the public or whether if it's recorded by the EMS or it's reported to anyone in the healthcare system and it is flagged in the system or not. So we anticipate that maybe in 2020 we've seen less because maybe for a fear, or maybe people are not reporting the overdoses, resulting in less alerts that we have issued. And also if it's spread out evenly, then you may not see those alerts because it meets the previous year's number and wouldn't raise a flag that something is critical happening. But just looking at our data for these months and seeing that the trend is changed from the previous years, that's why these alerts are addressed. So it's not just the absolute number of people that are showing up as an overdoses, but it also is a combination of, are we expecting this year to be to have how many overdoses for this time of the year? And if it exceeds that threshold, then those it triggers the alert. So I think it will be a combination of both, and that's why we didn't issue that many alerts.
Thank you.
Any questions from CTV?
Yes, regarding booking an appointment if you're 40 and older, do we have enough supplies at this point? And if so, how long is there going to be a wait time, or how are things looking at this point?
So we do manage our booking system every day. We look at how many people are able to book and if there are available spaces. And then we open up more days as everything becomes booked. So we do monitor that very carefully. And we may be a week out, but we don't go too much further than that to make sure that we allow people to book every available appointment. So as we move down to 40 years and over, we do know that we have really good coverage in the other age groups, and so we're able to move down confidently and offer vaccination opportunities. We also know that we have pharmacies in the area that are also offering vaccinations, and we have primary care providers that are also participating in offering vaccinations to clients and others. So there are opportunities across Windsor and Essex County, not only through mass immunization sites, but through other channels as well.
Thank you, that's everything.
Any questions from CBC?
Yes, good morning. My understanding, based on looking at the provincial government's website, is that the Moderna vaccine rollout in pharmacies is open to everyone, not just hotspot residents. I'm wondering, is it the intention still for people within hotspots to access those vaccines? And do you have any concerns that the shots won't be going to where they're most needed, at least according to the hotspot designation?
So right now, our pharmacy pilot with Moderna are with pharmacies that are in the hotspots in 14 pharmacies across the 7 hotspot areas. And they have very limited vaccine. They're only getting about 100 doses per week. And so we are asking that it's for people that live in those hotspots. So even though the provincial their plan is to open it up across many, many pharmacies. With our limited amount, it really will only be able to, our pharmacies will only be able to offer it to those living in that area, and it's very, very limited right now.
Okay, thank you. Tomorrow, the Group 2 essential workers are going to become eligible across the province. I know that the Pfizer vaccine has been approved for children 12 and up in Canada. I'm wondering, are there any plans to include teenagers who might be working on the front lines in the service industry? And if not, do you think that this should happen?
So just to clarify, for the provincial announcement for the group 2, we have to look at our numbers, our data, our availability of the vaccine. So it's not a guarantee that we will open it up for tomorrow for group 2 workers. So we'll have to look at that. So I just wanted to make sure that we are clear about that. The provincial announcement is there for everyone who's in the booking system. We have to look at our local situation, and then we'll send the notification, whether it's tomorrow or maybe a few days after, about the group 2. So I want to make sure that thing is clarified. To your second part, for the teenagers, as you're referring to, working in these businesses or these critical grocery stores or other retail stores, their eligibility right now, the eligibility is limited to 18 plus only, and not anyone who is younger than that. And partly because of the availability of the vaccine and a policy decision, not necessarily based on the whether they're eligible to receive the vaccine based on the age. Everyone is eligible to receive the vaccine in Windsor-Essex, but some of these policy decisions are there to gate the number of people who are accessing the vaccine because of the limited supply. So we'll have to look at that. We haven't heard any indication at this time from the ministry or from any group that goes under 18 years of age for the more broader general category. There is lots of work that's been happening right now to address the vaccine for people for children between the ages of 12 to 18, and some of those directions will be coming out in the coming weeks. I don't have a deadline in front of me, so I don't know when, but the provincial working group is working on providing those specific recommendations for anyone who is under the age of 18 or between the ages of 12 to 18.
Thank you very much.
Any questions from Blackbird?
Yes, just to clarify what you just said. So, the province has announced that they're opening their booking system for group 2. The local system may not be, starting tomorrow?
That is correct, yes, because our rollout sometime is based on our local priority and local situation that we are dealing with. We try to align ourselves as best as possible with the province. And one of the differences, as you probably have noticed, that the province will be going to 40 plus on Thursday. We are going today. So there are some of those differences that has been there for some time, and all based on the supply, all based on our local situation. So we plan to align. So I don't know when, but just don't want to set up that expectation that tomorrow is the day for our group 2 to start registering and start booking for the vaccine. We'll try our best to have the system in place to allow them to book and register for vaccine, but I don't want to commit to a date for tomorrow, but it will happen as soon as possible.
Okay. And it's frustrating for you to not have, I guess, a heads up when the province moves along this thing. I feel like it's confusing, even for our readers to see one thing, the provincial site, one thing locally, one thing pharmacies. I see a lot of confusion. Would it be better to kind of streamline this process?
Well, in an ideal world, yes, but we recognize that Ontario is very diverse, with many regions have very different needs, different expectation, and different resources to support all of those needs. We have been very proactive in terms of looking at our needs and making decision that makes sense for us. And my recommendation, as we have always said, that please look at your local recommendation and what we are focusing on locally. And I get it. Everyone wants to get the vaccine as soon as possible. And trust me, I also want to provide vaccine to everyone as soon as possible. It's just a matter of demand and supply. And we're trying to make sure that we are balancing everything and to offer these vaccines. But for any differences, if you're seeing, please look at your local data, local guidance document, and contact us, and we'll make sure that as best as we can try to align with the province, but there may be some local differences just based on our local situation, our demand and supply.
Okay, and just to clarify, I think you said this last week, expecting around 22,000 doses this week, and half of those would be committed to the hotspot region?
Yes, with the allocations, about 11,000 of the doses are designated for hotspots, but we do know that we're meeting that or more. So there's lots of availability right now, and we are using all of our vaccine.
And what is the expectation for the coming weeks? Do you have an idea of that?
The amount of vaccine for the coming weeks, it does go down a little bit, and don't have it right in front of me, but it does. This is May 10th and May 17th, I believe. The week of May 17th, it goes down a little bit to about 17,000 doses for a couple weeks, and then it goes up to, toward the end of May, beginning of June, it'll go up to about 21,000 doses as well in our area. And that's just for Pfizer that I'm talking about.
Thank you.
Any additional questions from the Windsor Star?
Dr. Ahmed, so all these appointments and clinics and mass vaccination programs are involving the Pfizer and Moderna vaccines. Has there been any talk about lack of supply for the AstraZeneca second doses?
So at this time, we don't have a clear line of sight, as Teresa mentioned, about Pfizer and some of the other vaccine that has been allocated to or that will be planned to come to our region. We obviously, there's nothing is confirmed. It's just the projection. We don't have much projection for AstraZeneca at this time, so I can't say when it will come. But what I can tell you is, most people who are due for AstraZeneca would start in July, so we still have some time. And as we have indicated in our broadcast last week, some of these there are some work that's happening to consider even using a combination of vaccines. So, for example, if someone has received AstraZeneca for the first dose, can they receive Pfizer for the second dose, or vice versa? So some of that work is also happening, and we anticipate that more clarity and more guidance will be there by the end of this month, and that will be shared more broadly. But please note that we do remember those people who have received AstraZeneca, and we want to make sure that we have a plan in place and we communicate it accordingly to anyone who has received AstraZeneca to make sure that they're not forgotten and they get their second doses as per provincial direction and as per indication.
Thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thanks.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone.